Hi friends, I'm Nurse Lizzie. Welcome to my YouTube channel. In today's video, we're going to be talking about 3 common misconceptions related to pediatric nursing. Before we go ahead and get started, please be sure to click the subscribe button below so you never miss one of my uploads. If you like this video, be sure to give it a thumbs up, spread the word to your friends, and don't forget to check out my website, nurselizzie.com, for more content coming your way. Now, let's get into those misconceptions related to pediatric nursing. Misconception number 1. Every shift in pediatrics must be so heartbreaking. So let me elaborate on why every shift is not heartbreaking in pediatrics. So you're going to have very difficult days, you're going to have difficult moments, and you are going to have some difficult shifts and weeks ahead when you decide to work in a specialized area, whether it's pediatrics, neonatal care, gerontology, you name it, okay? But what's important to remember is that every shift is not heartbreaking. While yes, there are some really difficult and complex cases, some diagnoses that we unfortunately don't have treatment for, and ultimately we do have to deal with death and loss, that's not every shift, that's not every patient, and that's not every day. There's a lot of wonderful celebrations. We see kids leave all the time, kids that walk out of the hospital that we never thought would walk again. So there's a lot of celebration in pediatrics, and it is a place where you can bring a smile to somebody's face. I think what's most important, if you are a student nurse and you're getting ready to go into a pediatric nursing clinical and you're feeling a little apprehensive, try to really let those thoughts and ideas and misconceptions that you might have just quiet into the back of your mind, because they simply are going to fog your experience. Try to keep an open mind and try to remember that you might have a difficult patient, or you might have a patient that you're taking care of with a really difficult diagnosis, but you can bring the smile to their face. You can make the difference in their day or their parents' day. It's the little things you do and how you care for them. But every shift is not going to be heartbreaking. So if that's kind of something you've been thinking about and it's maybe stopped you from going into peds or even considering going into peds as a future career, please just get that idea out of your mind, because I can promise you, as somebody who worked in PICU, in pediatric oncology, med-surg, and gastroenterology, that yes, while I have seen my share of difficult situations, again, it's not every shift, or I wouldn't have been able to continue to do that for over 10 years. So misconception number 2 is that dealing with patients' parents must be really scary. So many students bring this as a concern when they come into my class and we're talking about the clinical setting and getting ready to go out to the hospital, especially those that may not have kids themselves or may have never taken care of a child. They have this idea of this fear when they walk into that patient's room and their parents are sitting there. And I can completely understand. I was a student too. But most often, it's not this scary situation. I think what's really important to set yourself up for success is, number 1, keep your focus on the child. That's ultimately who you're there taking care of. That's your sole job on your pediatric nursing clinical rotation. And as the pediatric nurse, yes, we care for families and we care for parents, but the very first person that you should be addressing or talking to is that child. So go in there confidently. Introduce yourself with a smile, make them feel that warm welcomeness, and you'll really see that parents will begin to trust you as you begin to build that rapport. After you show them that your focus is really on their child, and then you talk with them, converse with them, ask permission to do the tasks you need to do, you're going to see, first, you're going to feel yourself relax, and secondly, you're going to see them relax. So it's really a win-win situation. And I think what really helps to remember is it's not that they're judging you or trying to be harsh on you. They just love their child and they want to make sure you're taking the very best care of them. I myself, I am a parent, and just recently we had one of our kids, unfortunately, was hospitalized. So I was on the other side of that. It wasn't that I was trying to be cruel or harsh. I just wanted to make sure my child was getting the very best care possible. So when you show that as a student and eventually as a nurse, when you show that to parents and family members that you're taking care of, people will trust you. And that's ultimately what your goal is. You want them to see that you're just there to take care of their loved one, do the very best you can, and make the very best out of the situation that's at hand. And finally, myth number 3, the misconception that you must first go into adult med-surg nursing prior to ever specializing in pediatrics. I hear this all the time from students. As I mentioned at the beginning, a lot of students enter pediatrics and they're really not sure, they're very nervous or fearful, or they might kind of feel lukewarm. They don't know if they love it or they hate it. They're just kind of middle of the road. And by the end of a 16-week semester, a lot of them will say to me, "You were right, I absolutely love pediatrics. I can really see myself working in this field. But I can't apply because everybody has told me I have to have this adult med-surg nursing experience." That is a misconception. So I hear many faculty members make that statement to students. And I myself, when I was in nursing school and faculty members were asking me as it neared graduation, what I wanted to do, where I was going to apply, the moment I said I wanted to be a pediatric nurse, everybody told me I couldn't do that. I first needed to get that adult med-surg nursing experience. And guess what? I took that advice and I really just let it go in one ear and out the other. I followed my heart. I applied right to PICU, which is Pediatric Intensive Care Unit, and I got the job. That was my very first nursing job right out of school. I didn't have adult med-surg nursing experience. I was literally a blank slate. That's not a bad thing. That's actually a really good thing. That means we can teach you all the things, all the nuances that you need to know to be a very safe and effective pediatric nurse. Now, if you are somebody that maybe you're currently working in adult med-surg experience and you've been considering jumping ship to come to pediatric land, which you should, please don't think that if you have that experience, well, then you're not going to be qualified to work in peds, because that's also not true. What that means is you've already got some background, some experience, and probably a really solid skill set that you're bringing with you to the table, and that will come in handy. You're going to know a lot of the pharmacology, the lab work, the interprofessional communication, collaboration, multitasking higher acuity patients with lesser acuity patients, admissions, discharges, all the things. You're going to bring that with you in your wheelhouse. And that's actually going to make you an even stronger pediatric nurse because you have that experience and background to bring with you. So please don't think that it's this end-all be-all where you either have to have this adult med-surg experience or you have adult med-surg experience and because of that, you can't come into peds. No. What we're ultimately looking for in nursing in any specialty is somebody that's adaptable and teachable. We'll teach you what you need to know. I promise you. So hopefully that helped to clear up some of those common misconceptions I hear all the time as a pediatric nursing instructor. Be sure again to give this video a like, share with your friends, subscribe to my channel, and don't forget to check out my website, nurselizzie.com, for more nursing educational content coming your way. Thanks so much for watching. Bye.